Hey there, I'm Dr. Tingle. I see we have you in for your annual physical exam today. Why don't you come on in, have a seat, relax and get comfortable. Just have a few preliminary questions before we begin your exam today, okay? All right. So from your chart here, it looks like they got your height and weight at the front, which is good. We'll get your blood pressure and temperature here. Any major changes to your health over the last year? No? All right, good. Any new medications? Okay. And any major surgeries or major dental work over the last year? All right, good. And how's that mental health been? Doing okay? Okay, good. Remember, you can tell me anything. It stays confidential between us. There's nothing to be ashamed of when it comes to getting help for our brains. All right, how about drug or alcohol consumption? Okay, let's try to keep the booze down. I don't count cannabis as a drug. Prefer you eat it, but, you do you. Try not to smoke a ton. Okay. Let's see. Okay, is there anything else that I should be aware of before we begin today's exam? Great. So I'm just going to glove up real quick, and we will begin your exam. Okay, now that I'm gloved up, we are going to start with getting your temperature. Then we're going to do your blood pressure and blood oxygen. I will give you a once over on your head and your face. We will then get your heartbeat, listen to those lungs, do a full body examination, as well as an eye exam, hearing test, sensation tests. All right, should be very relaxing, very easy. So, real quick, just like to get your temp. So just open up, say ah, and we're just gonna hold that there. Good. All right, 98.6, perfect. Now, if you don't mind, can I please have your finger? I'm gonna slip the blood oxygen monitor on, if you don't mind. Great. Good, just have that there for a moment. And I'm going to slip the blood pressure cuff on your arm. Just gonna get that on there. Good. And I just put my stethoscope on. Hold your arm, and we're going to get that pumped up, okay? Good. 120 over 80. Perfect. That's what we want to see. All right. Let me get that oxygen monitor off you. Good. Good. Okay. Let me just put this away, and we'll move on to the next portion of the exam. Okay. So I'm going to start with just doing a general scalp inspection, face inspection, and then we will listen to your heart, lungs, and cover the rest of you, okay? So you just relax. You can close those eyes if you wish. I'm just gonna come up real close, and I'm gonna check out your scalp here. Just gonna run my fingers through your hair. Good. I'm not seeing any signs of lumps, bumps, or any damage, so that's good. Great, so I'm just going to examine your face real quick. I'm just going to look at your forehead here. Good. You're doing great. Check out your temples. I'm going to just palpate them very gently. So just let me know if it feels the same or if one side feels different than the other. Ready? And good. And press, press, press. One more time. Press, press, press. Good. Any pain? All right. I'm going to palpate down your nose and under your eyes. Check your sinuses. Just relax. Good. Good. And I'm going to go into your sinuses. Just going to gently run my thumbs there, looking for any signs of inflammation, but doesn't seem to be any. So good. Any pain? All right. I'm going to check out your jaw. Just lift your chin a little for me. Just going to feel back there. Feel your lymph nodes. Good. And while I have you here, do me a favor. Clench real hard for me. Clench, clench, clench. Good. One more time real hard. Good. Feel your trachea now. Just gonna gently press on both sides. Good. I'm gonna move it to one side and to the other. Good. And while I'm holding it, just swallow for me. Good. All right. Check your facial muscles now. So I want you to raise your eyebrows for me. Like that. Like that. Like that. Good. All right. Give me a big smile. Good. Give me a big frown. Good. Puff your cheeks out for me. I'm going to try to pop, pop, pop them. Don't let me pop them. All right. Ready? Just like that. And pop, pop, pop. Good. One more time. Keep them puffed. Pop, pop, pop. Good. All right. Everything's looking good on the face so far. I'm going to take a look inside your mouth real quick. So just open up, say ah. Just want to take a quick look at the back of your throat. Good. You feel it looks good. No signs of splotches or red patches. Teeth look healthy. You go to the dentist twice a year. Cleaning's good. All right. So far, so good. Just gonna make a quick note. Okay. All right. So, just one last part of your face. I'm gonna take a look up your nose real quick. Just make sure that those sinuses are all clear. So just lean back for me. I'm just gonna take my scope and just slip it up there. Take a look. Good. And on the other side here. Okay. Good. No signs of inflammation. Not a problem. So we are now going to move on to your eyes. This is going to be very easy, very relaxing. If you had any changes in your vision in the last year. Okay, good. We're going to start very easy with the pupil dilation test. So what I will do is I will take my occluder here and I will hold it up just like this. And I'm going to take the light, I'm going to swing it in and then out. And watch your pupil dilate and contract. So just relax. I'm just going to hold this up just like this. And in, out, in, out, in, out, in, out, in, out. Good. And we're going to do the other side now. Same thing. In, out, in, out, in, out, in, out, in, out. Good. You are doing fantastic. Just going to move on to the fun little eye chart here. I'm sure you've seen this before. Just want you to read the letter that I point to, okay? So we're going to start real easy right here. Good. And this one. That one. This one. And let's go to that. Can you read that one down there? Good. Good. Very good. Good. And how about this bottom line here? Good. 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 Great. Excellent. That was perfect. We're going to do another one real quick. Just in numbers this time. So just this one and that one. Good. And this one, and that one. Good. So far, so good. And now we're going to do one more actual eye test with the good old Ishihara plates. So I'd like you to just tell me what number you say. Good. And that one. That one. Good. How about that one? That one. Good. And this one usually stuck to people. Excellent. Fantastic. I gotta say, you might be my #1 patient. You've aced every test so far. Absolutely fantastic. But we're not done with those eyes yet. I'm going to pop the ophthalmoscope head on my light here. And what I'm going to do is have you look straight at me. I'm going to get very close and take a look inside your eye just to make sure that everything is looking good, that there's no signs of inflammation or any damage to your optical nerve, okay? Alright, so just look straight at me and follow my instructions, please. Okay, look straight, good. Now please look up for me. Good. And down. Good. To the left. And to the right. Good. And up and to the left. And up and to the right. Good. To the other side, same thing. Just look straight at me. Look straight. Good. Up. Good. Down. To the left. To the right. Up and to the left. Up and to the right. Good. No signs of damage or copper wiring here. Or the other one. Very good. Alright. I'd like to run a few more eye tests on you. Very simple, very easy. The first one is I want you to just look straight at my finger. Good. Now I want you to follow it as it goes in and then out. Okay? Just focus on the finger. Good. On the finger. Good. 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 Alright. And this one, same thing. Good. Okay, just looking, make sure your eyes are focusing properly. Good. Okay, good. I would like you to just focus on my finger again. Do not pay attention to the light. Just ignore the light. Don't pay attention to the light. Good. 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 Alright, this time I want you to follow the light. Both eyes. Good job. Good. Alright, I'd like to check your peripheral vision. Super easy. I'm going to take my fingers. I'm going to do this. You let me know when you can't see them and when they come back. Alright, let's go. Ready? And good. And good. 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 How about this way? Good. Fantastic. Good. Good. Alright, those eyes. Checking out 100%. Do have one more fun little test. This is kind of a twofer. So first I'm going to have you identify some colors. So first one is red and pink and a yellow teal, blue. I'll accept either. Okay, so now we're gonna do a little test. It's kind of a check your reflexes and to make sure that you can follow instructions, alright? So I'm gonna hold up the red and the blue. And what I'm gonna have you do is I'm gonna instruct you to just reach out and touch the color that I tell you, okay? Very simple, very easy. Ready? Red. Good. Red. Good. Blue. Good. Red. Good. Blue. Red. Blue. Red. Blue. Blue. Red. Blue. Red. Red. Blue. Very good. Great. All right, we're going to move on to your ears now. Have you had any issues with your hearing? Any pain, ear infections, anything like that? Okay. And have you had any kind of massive wax buildup or anything like that? All right. So I'm going to grab my otoscope. Take a quick look inside those ears, see if there's anything going on. Do a few hearing tests, and we will get to checking over the rest of you. Alright, so scope on. You can close your eyes. I'm just going to come over here, and I'm just going to insert the otoscope into the ear canal and take a look. Okay, tympanic membrane looks nice and pearly, very nice. A little bit of wax buildup, but we could take care of that at a later appointment if you'd like. Okay. Alright, check the other ear. Same thing. Just going to gently insert the otoscope and a little more wax in here, but no signs of inflammation. And it does look like the tympanic membrane looks very good over here, so I'm not too concerned. I'm going to just do a quick test called pneumatic otoscopy. So what I'm going to do is attach this little tube right down to this little bulb, and I'm going to put the otoscope back in your ear, and I'm just going to gently, and what that's going to do is stimulate the tympanic membrane and let me see if it's working properly. So you can close those eyes. I'm just going to come over here, take a look, and 1, 2, 3. Good. 1, 2, 3. Good. And 1, 2, 3. Good. See? Feels pretty nice too. Do the other side now. So just relax and gently put the otoscope in, and 1, 2, 3. Good. 1, 2, 3. And 1, 2, 3. Good. Everything's working great. We're going to do some hearing tests on you now. So I'd like you to close those eyes. I'm going to whisper a word in your ear, and you just repeat it back to me. Alright, so keep those eyes closed for me. And coconut. Good. Summer. Good. Dream. Great. Relax. Good. Vacation. Very good. Alright, I'd like you to keep those eyes closed again. We're going to use the tuning fork now, and I'm just going to ring it gently. Hold it up to one ear, and you let me know which ear you hear it in, and you let me know when you can no longer hear the tuning fork, okay? Alright, here we go. Keep those eyes closed for me. And good. Good. Great. Good. And now I'm going to do the same thing, but I'm just going to use my hands to make a noise. So you let me know what you hear the noise in. Good. 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 Both good. Good. Yep. 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 Very good. And now you let me know when you can no longer hear the noise. Good and good and good and very good. All right, go ahead and open your eyes. And now we are going to take a look at the rest of you, okay? So I'm going to start with your neck and then move to your shoulders, your abdomen. We're also going to take a listen to your heart and your lungs. And then we're going to check out your tummy and your legs, as well as check those reflexes, okay? All right, so you just relax. I'm just going to check out your neck here. Good. And your trapezius muscles. Good. I'm going to ask you to shrug your shoulders up. I'm going to try to push them down. Don't let me push them down, right? Shrug it up. And 1, 2, 3. Don't let me push them down. Don't let me push them down. Don't let me push them down. Good. Do that one more time. Shrug them up. And don't let me push it down. Good. Don't let me push it down. Good. And don't let me push it down. Good. I'm going to move to your arms now. Just going to inspect, check out everything. Move down to your hand here. Inspect those fingers. Good. Good. Let me check out the other arm here. Good. Muscular structure feels very good on this arm. Good. Check out the fingers. Good. All right, good. Speaking of your fingers, why don't you follow along with me, okay? Just to check your dexterity out. So just do this, okay? This, that. You follow along? Good. Good. All right. Just spread your fingers wide like this. Very good. All right, so I'm going to take a listen to those lungs of yours and your heart. Let me grab my stethoscope real quick. All right. I got my stethoscope here. You just relax. I'm just going to come in and listen to your lungs real quick. Just take a normal breath for me. Just in and out. Good. And in and out. Okay. All right, here. In and out. Good. And in and out. Good. Now take a big, deep breath. Good. And I'm going to go down to your tummy. Just listen to your diaphragm for a sec. Okay. A little lower. Just going to listen to your intestines. Make sure I don't hear anything abnormal. Good. Okay, so everything sounds good there. Have you ever noticed any pain in your chest or your heart when you exercise? Good. Speaking of heart, I did not listen to that, did I? One more time. It's been a long day. What can I say? I've seen like 30 patients today. All right, so just relax. Just gonna listen to the old ticker there. Sounds pretty good so far. All right. That sounds great. No signs of any kind of palpation or anything like that. So I'm just gonna make a quick note real fast, and then we're going to get on to testing your reflexes. All right, so got my little reflex hammer here. Just going to do a little tapping on your joints just to make sure everything's working properly, okay? Start with the elbow there. Just going to come over here and 1, 2, 3. Good. 1, 2, 3. Good. And the other elbow. 1, 2, 3. Good. 1, 2, 3. Good. Check the wrist. 1, 2, 3. Good. And 1, 2, 3. Great. And on the other wrist. 1, 2, 3. Good. And 1, 2, 3. Good. Check your knees now. Just let that leg hang loose for me. And 1, 2, 3. Good. One more time. 1, 2, 3. Good. Other leg. 1, 2, 3. Good. And 1, 2, 3. Good. How's your back been? Any back pain? Alright, I know we all sit way too much these days. Lower back pain is super common. I highly suggest making sure that you get at least an hour of exercise 3 to 5 times a week, but try to move around as much as possible during the day. Get up, take breaks, get a standing desk if you can for work, or even better yet, get work to pay for one. It's good for your health, and a healthy employee is a lasting employee. I'm kidding, screw corporate. But we're going to do one last examination on you, the most relaxing exam that we offer here, which is a sensation exam. So what that's going to do is I'm going to have you close those eyes, and I'm going to touch you with 2 different objects, and you're going to tell me which one is which. So we're going to start very simple. You're going to tell me if I touch you with the very dull acupressure tool or the soft cotton bud, okay? So close those eyes. And dull, very good. Soft, dull, soft, dull, good. Keep your eyes closed for me, please. And you let me know, can you feel this soft object? Good. And can you feel there? Good. And dull, very good. Soft, dull, soft, dull, good. All right. And now this time I'm going to ask you to discern between 2 points like that or 1 point, okay? All right, so keep those eyes closed for me. And 2. Good. 1. 2. 1. 2. 1. 2. 2. 1. Fantastic. You can go ahead and open your eyes. And that, my friend, is going to conclude your annual physical exam. I have to say that you are 100% in perfect health, and I would like you to schedule another appointment for 6 months from now, just as a follow-up, and I'd like you to schedule an appointment for an ear cleaning. So you can subscribe and just click that button down below so that you never miss an appointment. And I want you to just go home, relax, and get a great night's sleep. All right? Okay. And we will see you soon. Bye-bye.